Hello, my name's Dr. Richard Kamrath. I'm an internist and endocrinologist, and I practice right here in Walnut Creek, California. In a way, Walnut Creek's like a small town. It would be unusual, actually, for me to go to a restaurant and not have someone recognize me or say hello or stop me. And my youngest is Jackie. She's a third-year medical student at Mount Sinai School of Medicine. And my older daughter, Kristen, is kind of the delight of my heart. She's a legal secretary over in Burlingame and actually dating a nice young man for a change. Every day in medicine's a challenge. You never know what you're going to see. You never know what the patient's going to bring with them. Even if you've seen a patient 3 or 4 times a year for 10 years, there's always something new, something different, some new part of their life that adds enjoyment to my life. Internists generally spend more time with their patients, perhaps, than a busy urgent care practice, and we like to think that we give the patients the amount of time they need to get through the questions that they have. I try to do heart-wrenching news at the end of the day. Try not to deliver heart-wrenching news on a Friday. It's hard on a doctor, too. I mean, we know these patients. Many of my patients have been with me for 20 years, so that's one of the harder things about medicine that's perhaps unrecognized, is how hard it is on a physician when someone you've known and grown to like actually gets very, very ill. Choosing a doctor is really, I think, a very personal thing, and I think it's helpful if there's a bond or a mutual trust. So I think you should look for a doctor that seems to look you in the eye, seems to hear and listen to what you have to say, and lets you finish your sentences and doesn't seem to jump to conclusions.